In this video, I'm going to show you how to fix pain at the bottom of the foot for good. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over a very easy to follow 3-part guide that can give quick and long-lasting relief for pain at the bottom of the foot, including for plantar fasciitis. All 3 parts work just a little bit differently, but when you put them together, you're going to get the best of everything. Make sure to go through all the exercises and use what gives you the most relief. As a bonus, all of these can be done at home, require no special equipment, and you may find give quick pain relief, even within 30 seconds. So let's get started and fix that pain at the bottom of the foot right now for good. In this part, we're going to focus on relieving soft tissue tightness, especially over the plantar fascia. When this becomes inflamed, it can cause plantar fasciitis and a lot of pain at the bottom of the foot. This is one of my favorite therapies. It's called gua sha or muscle scraping, and it's very easy to do. We just need a couple things. The first being a form of massage oil or lotion, anything designed to be put on the skin. The next is a large metal spoon. I like one with a little bit more thickness to it. You get better results. So start off by taking your massage oil or lotion and coating the whole bottom of the foot, the top, the sides, around the ankle, Achilles, and the calf muscles. We're going to focus on everything and be thorough to get better results. So with the spoon right here, it doesn't matter what part you use. You can use the handle, the tip, the rounded portion. I would experiment with all of that, and whatever works better for you, go with it. As a note before we start though, we're only going to go over soft tissue like muscle, anything that you can pinch onto. You want to avoid anything that feels bony, including joints or a bunion if you have one of those, because it can cause a lot of irritation and we definitely don't want to do that. So let's take our spoon, and what you're going to do is angle it roughly 30 to 45 degrees, start right below the big toe, right in the ball of the foot. You're going to press in there where it's going to be a very comfortable self-massage but not causing any discomfort. Do a slow stroke downward just like this, kind of glide it over the skin. It usually feels really, really good. I'd like to go over one spot roughly about 5 times, and then from there I move over just a little bit and repeat. I do this whole process pretty much going from the big toe, working my way to the outer part of my foot. When you do this too, you may notice that red pockets start to form over the top of the skin. I don't know if you can kind of see it over the video right here, but a little bit's forming. That's a good thing. That's blood flow coming to the area, which helps promote healing. You may also find that one certain spot just feels really, really gritty, almost like sandpaper. That's generally a spot of adhesion, which you really want to focus on breaking up because it can give you more relief. But pretty much do this whole area, starting from the top right here, working your way in, work your way down towards the heel. Any spot that feels like it needs more attention, stop over it at that point and throw more repetitions in until you really start to feel it break up. You're going to repeat this pretty much all the way around the heel. You want to do it around the ankle, obviously staying off that bony part right here. Go over the Achilles, the calf muscles, and work your way around the shin and the top of the foot. Really explore the area and target those tight, achy spots as much as you can. From there, you can then use different parts of the spoon, like the rounded portion right here, to dig into any spots that you found needed more attention. You can also attack those tight, achy spots, those fibers, at different angles too. So instead of going straight up and down with it, go at a 45-degree angle. You'll just notice it hits it a little bit better. And if you feel like that one right there just allows you to get better results, again, go with that. I also like to take this one to the next level by stretching the bottom of my foot out, that plantar fascia, just a little bit more with what is known as a toe spreader. So I take my fingers, I put them right in between my toes, and then I pull my toes toward me like this until I feel a really deep stretch, pretty much from my heel all the way towards the bottom, or I should say the ball of the feet right here. And at that point, I'm just going to repeat this process. This can make it a lot more intense, so only go to your comfort level. So give that one a try. Again, explore the whole area, use different parts of the spoons, different angles, anything that works better for you, go with it. In this part, we're going to focus on a self-mobilization or self-reset technique for the foot. It's a personal favorite for many because you can get a satisfying self-pop or crack in the foot. It usually feels really good also. We're going to target what are known as metatarsals, big long bones in the foot. When these drop or become raised, they can cause pain pretty much throughout the whole foot and also cause what is known as metatarsalgia, a lot of pain in the ball of the feet. So I'm going to show you two different ways to reset these. The first one is going to be correcting a metatarsal that has dropped downward. So let's find our contact point to begin with. I'm going to start right here at the big toe over the first metatarsal. The big toe right here, we're going to find two knuckles, I like to call them. You have one right here, but if you trace down a little bit and move your big toe, you're going to find another one right here. We want to focus on this second knuckle joint. The metatarsal pretty much is right at the bottom of that knuckle joint, the head of that metatarsal. That is going to be our contact point. So if you take two fingers and pinch right below and above that on your foot, you can start to trace that metatarsal all the way down. We want to go all the way towards the top though to start with. So I'm going to take my hands, overlap them like this, and then support the top of my metatarsal just like this. My thumbs are going to then go right over the head of that metatarsal. The movement is very easy. What I'm going to do is try to expand the top of my foot by supporting it, by also trying to kind of put like a U shape in like this to help stretch it open, while then pressing into that metatarsal at the same time, just like this. So if it's dropped, what we're doing is raising it. And if this is dropped, you can get a sudden clunk, pop, or release in there, but don't try to force it. What I do is I try to hold this one comfortably for about 15 seconds. I just relax and then throw in another repetition or two if it feels like it needs it. But from there, I just trace down a little bit more and repeat. I'm going to do this over the whole length of that metatarsal. Wow, that is a really sore spot for me. You're also going to find pockets that are just really sore, like muscle tightness, and at that point you can just really dig into those muscle knots too and focus on kind of like a nice circular massage while you do this. It's a really nice technique. But you're going to repeat this whole process, pretty much going from the top all the way down to the bottom right through here, and then you're going to move over to the next metatarsal. Again, you're trying to expand the top of the foot, pressing in there at the same time. But go only to your comfort level, explore the whole area, and any spot that feels like it needs just a little bit more attention, or if there's like a certain metatarsal that definitely feels like it's more locked up, the hot spot per se, throw some more repetitions in at that point. So next, let's focus on a metatarsal that has raised at this point and we need to drop it back down. For this one, again, I'm going to start right at the first metatarsal. This time around though, I'm going to pretty much make a cup with my fingers right here and then support right on the outside of my foot. I'm then going to use the meaty portion of my palm right here to press right on the head of that metatarsal. The movement is easy. I'm clamping down and then pressing down at the same time. If you notice, what this does is it takes that raised metatarsal and drops it down. Again, you can get a sudden, oh, actually I just got one right there, a sudden clunk with this one. I do this one almost daily. It usually feels really good, but I hold it for a very comfortable stretch for about 10 to 15 seconds. Just relax and then repeat this one again a couple times, and then I just move down like this. Let's see if I can actually get one more to release right here, but usually it's always about the third metatarsal that just really opens up for me, and it usually feels really good. But you're pretty much just going to repeat that whole process, working your way then down towards the outer part of the foot. Again, any spot that you feel needs a little bit more attention, at that point, throw some more repetitions in. In this part, we're going to strengthen the muscles that help support the feet. If your goal is to get long-lasting pain relief, possibly even get rid of it for good, make strengthening your main focus. I'm going to begin by targeting two muscles, the tibialis anterior and the tibialis posterior. When these muscles become weak, strained, and inflamed, it can cause a lot of issues throughout the feet, including heel spurs, collapsed arches, plantar fasciitis, just a whole lot of pain on the bottom of the foot. So let's start by doing the tibialis anterior raise. We're going to go next to a wall or a door for this one. To get into position, you're going to have your legs hip width apart, feet slightly out in front of you, knees straight, all of your body weight onto your heels. That way we can lean right into this door or the wall. I'm going to have my whole backside flush against it. From there, I'm going to keep my back straight and slowly pivot forward through my waist, lifting my shoulder blades and shoulders slightly off that wall, so only my bottom is going to be supported. Next, I'm going to then raise my toes upward towards the ceiling as much as I can. The more that you go up, the more that you're going to feel a deep activation of a lot of muscles into the calves, but more importantly, the muscles on the front part of the leg over the shin. That is the tibialis anterior. So you want to hold this position for about 5 seconds. You're just going to relax and then repeat this one 10 to 15 times. With each repetition, challenge yourself to go up just a little bit more. If you feel like you have a little bit more energy, throw in another set or two. But if you would like to take this one to the next level, space your feet slightly further away from that wall. The further you go out, the harder this will become. So next, let's target the tibialis posterior muscle. So how we can help strengthen the tibialis posterior muscle is with an exercise fittingly called the tibialis posterior raise. For this one, we need an object that we can place right in between our heels. A tennis ball works perfectly. If you don't have one, you can also just roll up some socks or use a towel. But start off by squeezing that object with your heels as much as you can. From there, place all of your body weight onto the balls of your feet and do a calf raise. That is just lifting your heels upward towards the ceiling as much as you can while also squeezing into the ball or the object as hard as you can. You're going to feel a ton of muscles start to fire in the calves, but more importantly into that tibialis posterior. Hold this one comfortably for 5 seconds. You're going to relax and then repeat this one 10 to 15 times, and with each repetition, build into it just a little bit more. Challenge yourself to drive your heels up and into that object as much as you can. And if you feel like you have a little bit more energy, throw in another set or two. So here's a strengthening exercise that can also help improve balance. I call this one the foot opener. I'm going to start standing and place all of my body weight onto one foot. I like to keep my back straight, put my arms out in front of me, kind of like a genie position. If you have a lot of balance issues or a lot of muscle weakness, you can definitely do this with a chair in front of you or next to a wall for extra support. But the movement pretty easy. What I'm going to do is move through my waist, turning towards one direction as much as I can. If you go inward, what you're going to do is put the foot into pronation or help to flatten the arch out. You'll really feel a very good stretch, but also a lot of muscles starting to fire to maintain this position. So challenge yourself to go in as much as you can. You want to hold this for about 5 seconds. From there, you're just going to relax, and now you're going to go outwards. When you go outwards, you're going to help to put the foot into supination, which really creates a larger arch into the foot. So if you have a fallen or dropped arch, really focus on this movement because it can really help to reform that arch. Again, a 5-second hold, you're just going to relax. And I like to do this one nice and slowly for about 5 to 10 repetitions on both sides. And it can become a little bit challenging too to do. And from there, if you would like to take this one to the next level, I like to use a tennis ball or anything that bounces while doing this movement. So I'll go in just a little bit, and now this time around, I'm just going to bounce a ball in front of me. What you're going to notice is your body really has to stabilize this movement. So give that one a try. Just bouncing this ball for maybe about 5 to 10 times and then going outwards with it and then repeating. Maybe you'll find one certain angle that is just a little bit more challenging. At that point, try to throw more repetitions in. And whatever you do on one side, always switch to the other to keep them both in balance. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.